You know that feeling? You walk into a doctor's office, you know you only have a sliver of their time, and you want to make every single second count.
Yeah, it's a common experience, unfortunately.
That's exactly what we're digging into today. How to truly maximize those brief healthcare appointments.
We're focusing on practical strategies to help you, our listener, make the most of your limited time with doctors and other healthcare professionals.
Consider this. A typical primary care visit hovers around just 18 minutes, sometimes even less.
Right, and if you're seeing a specialist, that window can shrink even further, often down to, say, 12 to 20 minutes.
It's incredibly short.
It really is. And within that incredibly short period, so much needs to happen. Your medical history needs reviewing, current concerns discussed.
An examination, maybe.
Exactly. Then explaining the findings, figuring out a treatment plan, and crucially, answering your questions.
It's remarkably tight time frame when you think about everything involved.
Definitely ambitious.
It really is. But the empowering part, I think, is that by being smart about how you prepare and how you communicate, you can actually turn those moments into really effective partnerships.
That's the goal. Today, we aim to equip you with exactly that kind of strategic know-how.
So we'll cover preparation, prioritization.
Communication frameworks, yeah, and follow-up to all crucial pieces.
Okay, so let's jump right into understanding why these time constraints are such a common reality in healthcare today. What's going on behind the scenes?
Well, it's important for you to understand the broader context. It's not always just about the doctor being rushed.
Right.
A significant factor is the widespread adoption of electronic health records, or EHRs.
Ah, the infamous EHRs.
Well, they were intended to improve care, but studies suggest doctors now dedicate roughly 2 hours to documenting in these systems for every single hour they spend face-to-face with patients.
2 hours of documenting for every 1 hour of patient time. Wow.
Think about that imbalance. It really changes how time is allocated.
That really casts those brief appointments in a new light, doesn't it? And you have to wonder how much mental energy is left after all that screen time.
Absolutely. And then there are the insurance requirements piling on top.
I suspected that might be part of it.
Definitely. The complexities of insurance, getting prior authorizations, tracking quality metrics for reimbursement, dealing with different plan rules, it all adds layers of admin
Which takes time away from.
direct patient care. Precisely. Resources get pulled away.
And then, of course, there's the fundamental issue of supply and demand, right? We keep hearing about physician shortages.
Yes, that's a critical element. The Association of American Medical Colleges, they've projected a potential shortfall of, well, it's a huge range, between roughly 54,000 and maybe up to 139,000 physicians by 2033.
That's staggering. A shortfall that large must put immense pressure on current doctors.
It does. It creates pressure to see a higher volume of patients just to meet the overall need.
I've also noticed a trend of smaller practices being bought up by larger hospital systems. Does that play a role too?
It certainly can. As practices consolidate, physicians often face productivity expectations.
Meaning patient quotas?
Essentially, yes.
Yeah.
Targets for the number of patients they need to see. This emphasis on volume can directly lead to shorter appointment slots.
So understanding these larger forces helps us see it's not just about feeling rushed. There are real systemic issues.
Exactly. And while advocating for system change is important, it's also crucial for you as a patient to develop your own strategies to navigate the system effectively right now.
To get the best care possible within these constraints.
Precisely. Which leads us directly to what you can do before your appointment even starts. Preparation is key.
Right. Maximizing the appointment really begins with that groundwork. So what are some key actionable steps listeners can take?
Okay, the very first step is clarity. When you schedule, be crystal clear about the reason for the appointment.
Like, is it a new problem, a follow-up?
A new concern, follow-up for a chronic condition, preventive care, like a physical, a specific procedure. Knowing the purpose helps the clinic allocate the right amount of time.
That makes sense. A complex new issue likely needs more time than a quick check-in. What about seeing a new provider for the first time?
Ah, good question. For a new doctor or specialist, creating a concise, maybe one-page medical summary is incredibly helpful for them.
What should go in that summary?
Key things: current medications with dosages, any allergies and the reaction, major chronic conditions, past surgeries or hospitalizations, and relevant family history. Just bullet points.
Like a quick snapshot of your health.
Exactly. Gives them a comprehensive overview quickly.
Even with a doctor you know well, it's easy to forget what you wanted to ask. How do you manage that?
Preparing a prioritized agenda is absolutely key. Research shows patients often have, say, 3 main things they want to discuss,
But there's usually only time for one or two, right?
pretty much. So before you go, rank your concerns. What's most important to you? Address that first.
Okay, prioritize. What if you have a tricky symptom, something that comes and goes?
Great point. For complex or fluctuating symptoms, keep a log. Track when they happen, how long they last. Severity, maybe use a 1 to 10 scale.
And what triggers it, or makes it better or worse?
Yes, triggers, what helps, what doesn't, and importantly, how it's impacting your daily life. An app or even just a notebook works fine.
That detailed info must be gold for the doctor.
It provides invaluable context. Medications are another big one. How should listeners handle that? A thorough medication review is crucial for safety. Before your visit, make a complete list of everything you take.
Everything, including vitamins and stuff.
Yes, prescriptions, over-the-counter meds, vitamins, supplements, herbals, everything. Note the dosages and how often you take them.
Or could you just bring the bottles?
Absolutely. If it's easier, just gather all the actual containers and bring them along. That eliminates transcription errors, too.
Good tip. What about past test results or reports, especially for a new specialist?
Definitely gather relevant records if you can. Lab results, imaging reports like X-rays or MRIs, notes from other specialists, hospital discharge summaries.
So the new provider doesn't waste time chasing them down.
Exactly. It saves valuable appointment time.
This seems especially important if you're switching doctors or moving. Okay, one last prep tip. Appointments can be overwhelming. It's hard to remember everything.
That's very true. This is where bringing a trusted companion can be incredibly helpful.
Like a spouse, friend, or family member.
Yes, especially for complex discussions or if you might receive difficult news. They can be a second pair of ears, take notes,
Offer a different perspective, help you remember things later.
all of the above. It can make a huge difference.
Okay, these prep steps sound like they can really set the stage for a much more productive visit. So you've done your homework, you're in the room. Now what? How do you communicate effectively in that limited time?
Right, this is where structured communication frameworks can really help you. They help organize your thoughts for clear, concise sharing.
Like a mental checklist?
Sort of.
Yeah.
One very useful method is called SBAR. Situation, background, assessment, recommendation.
SBAR. Okay, break that down. How does a patient use it?
You start with the situation. Briefly state the main reason you're there today. Then, background. Relevant context. When did it start? Happened before? What affects it?
Got it. Situation, background, then assessment.
Assessment. Share your take. How is it affecting you? What do you think might be going on? And finally, recommendation. What do you hope to get out of this visit?
Okay, let's try an example. Say, someone have headaches. How would SBR sound?
Okay, instead of just, I have headaches, you could say, I've had worsening headaches for 6 weeks. Situation. I don't usually get migraines, but my mom did. They hit mid-afternoon and make work hard. Background.
Much clearer.
Then, I'm wondering if it's stress or tension, but I'm not sure. Assessment. I'm hoping today we can find triggers and figure out relief and prevention recommendation.
Wow, yeah, that's so much more focused and informative right from the get-go compared to just, I have headaches.
Exactly. Are there other tools like SBRR?
Yes, another helpful one for describing specific symptoms is PQRST.
PQRST. Okay, what does that stand for? Provocative palliative, what makes it better or worse? Quality, what's it feel like? Sharp, dull, throbbing. Region radiation. Where is it? Does it spread?
Okay, PQR, what's S?
Severity rated on a 1 to 10 scale. And timing, when did it start? How often? How long does it last?
So PQRST helps you paint a really detailed picture of the symptom itself.
Precisely. Much better than just my stomach hurts.
What about that classic opening question? What brings you in today? How should you respond?
Resist the urge to launch into a long story right away. Offer a brief headline first.
Like a summary.
Yeah. For example,
Sure.
I'm here because of a persistent cough that started 3 weeks ago. Then pause. Let the doctor ask for more details based on that.
Okay, start with the headline, then let them guide the details. Good tip. What about listening effectively?
Active listening is crucial. Try not to interrupt while your provider's speaking. Let them finish their thoughts.
Easier said than done sometimes, but important.
And to check your understanding, paraphrase back what you heard. So, if I understand correctly, you want me to try this new medication and follow up in a month.
That confirms you're on the same page and catches misunderstandings.
Exactly. It shows engagement too.
I've also heard about something called the teach-back method. What's that?
Teachback is fantastic for confirming you've grasped instructions. After the doctor explains something like a medication plan.
You explain it back to them.
Yes, in your own words. Okay, just so I'm sure I'll take one pill with breakfast, one at bedtime, and call if I feel dizzy.
Ah, I see. It catches any confusion right there in the room.
Immediately. It ensures you both leave with the same understanding.
Smart. What if you disagree with a recommendation or have concerns about it? How do you handle that respectfully?
The feel, felt, found approach can be useful here. It helps express concerns without being confrontational.
Feel, felt, found. How does that work?
You could say something like, I understand you feel this medication is effective, feel, and I see why others felt comfortable trying it, felt. However, I found some info suggesting a potential interaction I'm worried about, found. Could we discuss alternatives?
That sounds much better than just saying, I don't want that. It keeps the conversation open.
Exactly. It maintains rapport while voicing your concern.
Okay, great communication tools, but what about prioritization? We know time is short. How do you decide what gets discussed when you have multiple issues?
This is where effective prioritization is absolutely essential. You just can't cover everything in one short visit.
So how do you choose? What's the most critical?
Start by distinguishing between urgent and important concerns. Urgent means active symptoms affecting daily life, or potentially serious things.
Like sudden chest pain, maybe?
Right. Important issues might be managing chronic conditions or preventive care vital long-term, but maybe not needing action today.
Okay, urgent versus important. That helps frame it.
And a good rule of thumb is the 1+1 rule.
The 1+1 rule.
Aim to focus on one major concern thoroughly. If there's time at the end, maybe bring up one secondary, less pressing issue.
Just one major, maybe one minor.
Yeah. Research actually suggests trying to tackle too many things means none get resolved properly. Better to focus.
Address one or two things well, rather than skim over several. Makes sense. What about thinking about the right provider for the problem?
That's a really crucial point. Is your primary care doctor always the best person for every issue? Maybe not.
Like a skin rash might be better handled by...
Dermatologist, exactly. Detailed medication questions, talk to your pharmacist, nutrition advice, a registered dietitian, mental health, a mental health professional.
So being strategic about who you see saves time and gets you the right expertise.
Absolutely. It maximizes everyone's time.
What if you're juggling multiple chronic conditions like diabetes and high blood pressure? How do you prioritize those?
That's a common challenge. A good strategy is to collaborate with your primary care provider to create a kind of rotation schedule.
Rotation schedule.
Yeah. Maybe agree to focus in depth on diabetes this visit and blood pressure next time, while always checking for urgent issues across the board.
So each condition gets focused attention over time without overwhelming one visit.
Precisely. It allows for more thorough management sequentially.
What if you know ahead of time you have something really complex that needs a longer discussion?
Don't hesitate to ask when scheduling if you can book an extended appointment.
Just straight up ask for more time.
Yes. Many practices understand some issues need more discussion and can accommodate that if you ask in advance.
Definitely worth asking.
Yeah.
Okay, so you're prepped, prioritized, you have communication tools. What about during the appointment itself? What actions help?
Okay, once you're in there, maybe start by politely confirming the time. I think we have about 15 minutes today.
Sets expectations.
Right. Then state your priority right away. My main concern today is this cough. Get it on the table immediately.
Don't bury the lead, basically. What about the flow of the visit?
It helps to respect the usual structure. History, exam, assessment, plan. Try not to interrupt the history taking with questions about treatment, for instance.
Let them gather the info first.
Yeah, it can disrupt their thought process if you jump ahead too much. Stay with the current stage.
Okay. How should you present your concerns most effectively? You mentioned symptoms.
Focus on specific symptoms, not self-diagnosis. Say, I get short of breath walking upstairs, not, I think I have heart problems.
Describe the what, let them figure out the why.
Exactly. Provide the clues. And use concrete examples for functional impact.
What do you mean by functional impact?
Instead of just, I feel tired, explain how it affects you. I used to work all day. Now I need a 2-hour nap and still feel exhausted.
Ah, quantify it. Show how it changes your life. That gives a clearer picture of severity.
Definitely. What about sensitive topics, things people might hesitate to bring up?
Good question. It's generally best to address sensitive issues, sexual function, mental health, substance use directly, not saving them for the last minute. Why not wait until the end?
Because time might run out. And these issues often connect to other symptoms and deserve proper discussion time. Be upfront.
Don't leave the most difficult things for when the doctor has one foot out the door. Makes sense. What about remembering everything discussed? We know it's hard.
Taking brief notes is a great idea. Or politely ask if you can record the important parts, especially instructions.
Is recording usually okay?
You definitely need to ask permission first. But given how much people forget, studies show patients forget 40–80% of medical info almost immediately.
40 to 80%, that's huge.
It is. And they only recall about half of what they do remember accurately. So notes or recording can be really valuable.
Those statistics are sobering. Really underscores why notes are a good idea. Okay, appointment's over, you're leaving. Is that it?
Not quite. Effective follow-up is crucial and often overlooked. The appointment doesn't end when you walk out the door.
So what should listeners be doing after the visit?
First, check your patient portal if you have one. Look for visit summaries, test results.
Use it as a reference.
Yes. And often you can send secure messages for follow-up questions too. It's a great resource.
Many people probably don't use those portals enough. What about actually doing what the doctor recommended?
You need a system. Schedule those referrals, fill the prescriptions, start the lifestyle changes, use calendar reminders, health apps, whatever works for you to implement the plan.
Stay organized and follow through. What if some things didn't get addressed due to time?
Explore other channels. Can you send a portal message? Call and speak to a nurse. Maybe even schedule a quick virtual follow-up.
Don't just let those unanswered questions linger.
Right. And keep a running list of those deferred issues. Prioritize them for your next appointment.
Ensure continuity of care.
Exactly. It prevents things from falling through the cracks.
All these strategies, from prep to follow-up, really empower patients, don't they?
Absolutely. It's about becoming a more proactive, informed partner in your own care.
Now let's take a moment to talk about the sources that informed this deep dive. Where did this info come from?
Sure. Our understanding of how doctors actually spend their time came from a time and motion study in the Annals of Internal Medicine. It really highlighted that documentation burden we discussed.
Okay. And the physician shortage numbers.
That was from a big report by the Association of American Medical Colleges, looking ahead to physician supply and demand up to 2033.
And the communication tips, like SBAR.
We drew on guidelines and articles about patient-physician communication, including work published in the Journal of the American Medical Association, focusing on effective information exchange.
What about the stats on how much patients forget? That was eye-opening.
Yeah, that came from a systematic review in the Journal of the Royal Society of Medicine, which looked specifically at patient recall of medical advice.
And the practical tips for making the most of the visit.
A lot of those practical strategies align with resources like the American Academy of Family Physicians Patient Guide on optimizing doctor visits.
Finally, the ideas around prioritization and structuring the encounter.
Insights there came from work by the Institute for Healthcare Improvement, which published a white paper on optimizing the patient-provider encounter for efficiency.
Great. So these insights are grounded in research and expert guidance.
Definitely. They reflect ongoing efforts to understand and improve clinical interactions.
So, wrapping this up, the key message seems to be that even with short appointments, effective healthcare partnerships are possible.
Absolutely. It hinges on clear communication from both sides, working within the real-world constraints.
By preparing, prioritizing, and using some of these communication strategies, you can make those brief encounters much more productive.
And like any skill, it gets easier with practice. The more you use these approaches, the more natural they'll feel.
You become a more effective advocate for your own health.
Exactly.
Join us next time on The Deep Dive, when we'll be tackling something else many of us face: navigating insurance denials and appeals.
Ooh, that's a tricky one. We'll break down why denials happen, the steps for appealing, and offer some practical advice for challenging those coverage decisions.
Until then, thank you for joining us and diving deep with us today.
And remember to stay curious about your health and the healthcare system.
And maybe think about trying just one or two of these strategies next time you have an appointment. See what difference it makes for you.